Always great to have Nisha Jackson in the house. She heads up Ventana Wellness, and you're welcome to join us on the conversation today. The phone number is 776-5368, so don't hesitate if you want to be a part of the conversation. Again, that's 541-776-5368. Well, drug dieting. You want to talk about that?
Yes. Actually, what I want to talk about is a couple different things, but a new medication was just FDA approved for weight loss. First medication in 13 years that was approved.
Really?
Pretty amazing, huh?
Yeah, let me get you plugged in here. We're having a little bit of a mic issue. There we go. She's here. Don't panic. She's here. Rick is enjoying this moment because her lips are moving, but we're not hearing anything.
Stop that.
Oh, there she is.
Actually, that's not true. In our family, Rick's the one that does all the talking.
Yeah, really? Just kidding. I had to do something to fill. Okay.
Okay, so anyway, what I want to talk about today is the new medication that was just FDA approved for weight loss, because it's the first medication in 13 years that's been approved for weight loss. And as you know, I love to talk about weight loss, and I'd love to talk about all of the negative effects of being overweight. And I've felt for a long time that this nation needs to do something about the two-thirds of our population that's overweight or obese. Wow. It's a huge problem.
Wow. So what is this drug? What's it do?
So this new medication that's coming out, we hope to actually have it on the market before the end of the year, or available to be able to prescribe by the end of the year. But it works on a receptor in the brain to actually help you feel full sooner or satiated sooner. So when people are eating, obviously the biggest problem is overeating and craving certain types of foods. So it adjusts your brain chemicals from a craving standpoint, but also gives you a sensation that you're full earlier rather than, leading to overeating.
Wow.
Yeah. So the old medication, as you may or may not remember, but the old medication that was, part of it was taken off the market, was called fen-phen, about 13 years ago. Right. And fen-phen, unfortunately, caused some heart valve related problems, or they thought that it did. Some people now believe that it never really caused any of those problems, but that put a little bit of a damper on the whole market of weight loss medications. But meanwhile, America has become so overweight in the last 13 years. And of course that leads to hypertension, diabetes, chronic inflammatory pain. So there's all sorts of problems stemming from being overweight. So now I think that the nation and certainly some of the drug companies are looking at how can we help people get a handle on their appetite and their cravings.
Is weight problem primarily a craving issue?
Well, it's not. The other topic that I wanted to touch on today is what happens when we develop more fat on our body than we should. And one of those things that happens when we develop too much fat, because fat is actually an organ on our body. We actually never really looked at it as an organ on our body, but it is. It's an organ. And it releases hormones and all sorts of chemicals. So just like any other organ in our body that becomes enlarged, like if our liver became enlarged and we developed a fatty liver, that would be very dangerous. Or our thyroid, which is a gland, becomes enlarged, that would be very dangerous too. Well, the fat on our body is also an organ, and when it becomes enlarged or you become obese, it develops a problem within our system because it releases chemicals and also hormones that cause inflammation or pain. So get this, Perry. So you become overweight, right? You develop too much fat on your body. Yeah. And then it starts developing these inflammatory chemicals that circulate throughout our system. Wow. And the inflammation then leads to pain. It also leads to high cholesterol. It leads to heart disease. It leads to diabetes. And so then people become less active. And so you can kind of see this really bad cycle that develops over time as you put on too much fat. So now we're actually looking at obesity a completely different way than we used to. We're actually treating it like a disease because it is a disease. And so the goal is that we know now that if you can reduce your percentage of body fat, you actually will release from your fat cells less chemicals that cause inflammation. So therefore you have less pain. So then you can be more physically active. So that's kind of where we're going with weight loss in the future, is looking at treating weight loss like it's a disease, just like diabetes, and being more aggressive at treating it. You know,
a couple things here. First of all, I have really grown to be very sympathetic and empathetic to those who try to lose. It's harder than people think. It's very difficult. I've watched people go to the gym, get discouraged, and leave.
Right.
And yet I've watched people go to the gym and get enthused. There's one man where I work out that I've watched in 18 months lose over 200 pounds.
Wow.
And so I asked him, I said, are you doing anything in the way of dieting? He said, no, I just changed my lifestyle, my eating habits.
Right.
I'm not on a diet, I'm just eating better and I'm exercising. But it took 18 months and he lost 200 pounds and he still has a few more to go. And it was a situation where he got up one day and he realized he was a walking dead man.
Yes.
So he made the mental decision
Switch.
and went for it.
And you know, Perry, there's so many stories like this where people say, I'm not going to be on a diet, but I want to be on a lifestyle plan that makes me healthier. I don't want to be in so much pain.
Yeah.
My blood pressure's going up. I'm adding more and more medications to my list of things I need to do every day. And people are making small substitutions, which really seems to be the answer when it comes to losing body fat, but also reducing your risks. And having less pain. And I keep wanting to tie in the pain and the increased fat cells because there's such a strong correlation and people feel better and they have less disease if they're creating less or releasing less inflammatory hormones into their system. So this is something that this man probably did also, losing the 200 pounds. You don't even have to lose more than 5 or 6 pounds to have less inflammatory hormones being released into your body.
Wow.
So it just takes a little bit of substitution. Even saying, I'm going to drastically cut back on flour and sugar. Just those two things alone will make a huge difference in your ability to feel better, but also release those fat cells, shrink them.
All right, let me just say to our listeners and viewers, you're welcome to join us. 776-5368. Nisha's here. Take your phone call, 776-5368. All right, let's come back to this drug that's going to be on the market hopefully by the end of the year.
Yes.
Long-term effect?
Long-term effects. So here's some of the recommendations by the FDA, or the requirements by the FDA for us to be able to prescribe this medication. It's called Belviq, is the name of the medication. And you have to have a BMI of 30 or more, body mass index of 30 or more, and you can look that up on the internet. It's bmi.com. Or you have to have a BMI of 27 with some other kind of medical problem like high blood pressure, arthritis, thyroid disease, hypertension, high blood pressure, and then you can use the medication. But if you've not lost 5% of your total body weight within 12 weeks, you won't be able to get the medication anymore because they really feel that it's not working for you. This drug was extensively tested in 8,000 patients over many, many years. It was originally declined by the FDA for some heart valve problems that they saw. But then when they tested it longer and it was slightly changed, they didn't continue to see those problems. And there was such a significant improvement in weight loss using this drug over people that just changed their diet and exercise. So those are going to be sort of the requirements for getting the medication. And if a BMI of 30 would be like a 5'9" woman, or excuse me, a 5'7" woman who weighs about 185 pounds, that would be a BMI of 30. So if you're at that point or higher, then you would be able to take the medication or use the medication.
Wow. All right, now you're obviously going to come alongside with a plan with this.
Yes, I think that the other requirement that will be set forth by the FDA is that in order to get the medication, you also need to be provided a diet and exercise plan, which I firmly believe in. Obviously, just taking a drug is not the answer.
Right.
And all of the patients that were tested in the clinical trial, whether they were getting a sugar pill, a placebo pill, or the medication, were actually given a diet and exercise plan that they followed for up to a year. So the important part is learning how to eat right. And my approach is more learning how to get everything balanced and reduce the inflammatory foods so that you can not only lose weight so much more efficiently, but you feel so much better and you can shrink those fat cells faster. That's the key, is eating the right food so that you can do that.
What do you say to people who are obviously aggressively trying to lose weight, but there's this up and down in weight loss, especially if you're on an exercise program? You're going to go from fat to muscle. You might even gain a few pounds. Right. And then you go down, then you go through a plateau where nothing's happening. Right. Do you tell them just stay off the scale for a couple of weeks?
Yeah, I think the scale is a catch-22 because the scale can make you very depressed and then cause you not want to, feel like a failure, and then you can't continue. But the scale can also keep you accountable. So you're right. right. Maybe weighing once a week or every other week and staying on a program is key. But Perry, it's so hard because it's so fashionable to eat bad. It's so in vogue in the U.S. to eat bad. You know, you see kids carrying around sugary drinks. I mean, it's just what people do. And that's what you're working against. You know, if you're an alcoholic, you just don't have alcohol in your home, right? You just, if you're trying not to drink alcohol, you just don't have it in your home. But it's so hard to get away from sugar and processed foods. It's so difficult because it's everywhere, and it's so okay for people to have it. And so that's why people kind of go up and down a lot. The other thing that happens, and you hit on it just a minute ago, is that when people lose weight, they often lose muscle if they're not exercising or doing some type of resistance training. And so let's say you lose 10 pounds. Well, you could, if you did some kind of radical weight loss, you like said, I need to lose 10 pounds in 2 weeks, and you did some kind of radical weight loss without any muscle resistance training, so no sit-ups, push-ups, lunges, any type of muscle resistance training. If you lost weight like that, you could lose, out of the 10 pounds, it could be 8 pounds of muscle that you lost, which makes your body look terrible, by the way. You just you don't look well when you lose weight.
Really wrinkled.
And then when you go to gain the weight back, you don't gain muscle, you gain fat. So now you've lost 8 pounds of muscle, but then when you gain it back, you might have gained 10 pounds of fat. So now you've got this terrible situation where you've lost your muscle, but you've gained more fat, and that's what lowers your metabolism, is gaining too much fat. Not only because the muscle is metabolically active, and single-handedly, one of the best things people can do for their metabolism is put muscle on, because muscle is your metabolism. It's the metabolically active part of your body. So that's the key, is when you're losing weight, trying to add the right types of exercise in so you actually put muscle on and you lose the fat, because you'll look awesome. Muscle is so pretty, it's really smooth and firm, and fat is very unattractive. It's very
lumpy. It's
lumpy, it's soft, it's not smooth, and it's not vascular. It doesn't have a good blood supply to it. So that's the key, is trying to lose weight the right way.
All right. By the way, if you want to join us, 7765368, Nisha's here, and we're talking about weight loss and the new drug that'll be out. What's it called again?
Belviq.
Belviq, on the market hopefully by the end of the year, so we'll keep you updated on that. Have you done the link between depression and weight gain?
Yes, there's a strong there's a strong correlation between depression and weight gain, and there's a strong correlation between eating bad foods and depression. So a lot of people say, why is it that I'm craving and I can't get a handle on my appetite or eating certain types of food? So let's say somebody really wants to stop eating sugar because they know they don't feel well when they eat sugar, they have more body pain when they eat sugar or a lot of flour products, but they can't seem to stay away from it. The chemical reaction that you get from sugar is identical to the addiction potential that somebody has between alcohol and alcoholism. It's almost identical. Wow. So it hits the same brain receptors as an alcoholic does for alcohol, as a person does to sugar. So if you're wondering why you're craving sugar, it raises serotonin and it makes you feel so good. That's why they call them comfort foods, right? A big, huge bowl of pasta or a couple of big pieces of sourdough bread with a lot of butter on it. I mean, that makes you calm down because it raises serotonin. It's just the feel-good, calming hormone. The problem is that it also raises insulin, and that can release those inflammatory hormones that we were just talking about. Yeah. And then it makes you store fat at a really high rate, especially around the middle part of your body. So while it makes you feel better initially, the downside is you get a spike in your blood sugar and your insulin, and then it drops off pretty abruptly, and then you want it again. So this addiction problem continues with the bread and the sugar. So that's why people want it, because it works.
Well, the wrong way.
The wrong way.
Yeah.
Exactly.
All right. Hi, Velma. You're on with Nisha. What's your question today?
In the Life Extension magazine and also on Dr. Oz about green coffee bean extract. Does that help you lose weight?
Did you say green coffee extract?
Yeah, green coffee bean extract.
Yes. Well, first of all, I think it's important if you're going to drink coffee to have organic coffee, because what you're trying to do here is you're trying to avoid a lot of the pesticides that are used in the production of the coffee beans. So that's one thing that's really important, because that's very much tied into weight loss and very much tied into those nasty chemicals that are released from your fat cells. So you're trying to really clean up your system. So the organic green coffee beans are also very helpful from an antioxidant standpoint. Obviously, there's lots of other antioxidants that you can have. Just increasing your fruits and vegetables in your diet, especially the most colorful ones, are very helpful for reducing fat, because they're fighting the free radicals that make those inflammatory hormones and chemicals circulate in your system.
Yeah, well, this is a supplement that you take.
Yes. So again, it's that antioxidant effect that's fighting the free radicals. So
do you think that helps?
I think it can help, but also adding other antioxidant foods to your diet can also be very helpful.
Okay, thank you.
You're welcome.
Hey, we're talking about losing weight.
It's a big topic.
It is.
No
really,
pun intended.
Well, no pun intended, but a lot of folks struggle with it and are trying to do it. And, you know, I realize it has to be a commitment and a lifestyle change. And somebody said, Patrick Doyle says, there's only two things that make you change in life, either inspiration or desperation.
Yes, that's so true.
You're either inspired to do it or you're desperate to do it.
Right.
And so
or a little bit of both, maybe.
When you reach those 2 points in your life, then you start making a change. But talk to us practically, Nisha, about those who realize, all right, I gotta address this issue. I'm overweight. Maybe I'm obese. Whatever the issue is. There's no quick fix here.
Right.
And I think they got to realize they're in for a long haul.
Yes. And the reality is that you have to keep doing whatever it is that you lost. How you lost the weight is what you need to keep doing. So that's why it's important to pick something that actually is something you could do lifelong. Because we have this mentality, because this is just the way Americans are, is let's just fix it and then we can go back to our normal routine.
Right.
Well, the normal routine is toxic, so you can't go back to that. And I've been working with patients now for 20 years trying to teach them that's not what you can go back to. Something has to change. And I believe the whole family has to change, not just the mother or not just one child in the family. Everybody in the family needs to eat better, not because maybe everybody needs to lose body fat or shrink their fat cells, but because it's more healthy. Now we know it's not just a matter of just losing fat cells or losing body weight. It's a matter of preventing disease. So you can have skinny Minnie in your home that's very sick because they're not eating well. So don't be confused about that. Anyone that's listening out there, don't be confused that just because you're thin doesn't mean you're healthy, and doesn't mean that you won't go on to have health-related problems because of what you're eating. So that's really the message, is that everybody needs to clean up their diet. Everyone needs to clean up their act.
Do you recommend a detox?
I think it's a good idea. You have to be careful with some people that are very overweight. If you go on a detoxification program, and this is why I don't like people just going to the internet and picking, ABC cleansing plan and going on it, because people who have a lot of body fat and they go on a cleansing plan or they go on a detoxification plan or some type of a liquid or pill or something to get some type of cleansing effect, you have so many fat cells on your body, and they're so enlarged if you're, say, 30, 40, 50 pounds or more overweight, that once you start detoxifying and those fat cells are releasing chemicals into your system, which is really what happens, people get very sick. They don't feel well.
Right.
So it has to be done the right way. And, a lot of people don't give enough credit to the what we talked about in the beginning, the fat being an organ in the body. They don't give the organ in their body enough credit. It can be very toxic, releasing literally hundreds of different chemicals into the body. So you have to be careful about how you do it. And I think having some guidance makes a difference.
Where do supplements come into dieting?
I think supplements are really important because, unfortunately, so many people today are not getting, just like our other caller, Velma, earlier about taking good antioxidants into your system, so many people are eating a diet that's completely void of anything that's colorful. I was just talking to a patient in the office a couple of weeks ago, and she was telling me that it's been weeks since she's had any fruit or vegetables in her diet, that she's just been eating fast foods. And Perry, that's really pretty common for kids today and teenagers and even young adults. They're not eating fruits and vegetables. They're perishable. They're sometimes considered expensive to buy. and they're just not eating them. And so they're not getting a lot of those antioxidants, the vitamin C, the vitamin A in their diet that they should. So supplementation can be very important because some people don't lose weight just because they have a nutrient deficiency. So replacing that can be very important. And then also back to that brain chemical thing I was talking about a couple of minutes ago, about when people are craving sugar, or they're craving a lot of flour foods and they're on and off, you have to fix the brain chemicals that are low. Now those can be tested in the medical office, but if you have a lot of cravings for sugar, it's more than likely that you're low in either the brain chemical dopamine or serotonin, the feel-good hormone. Yeah. So there's a couple of things you can do. One, you can take a supplement called 5-HTP. Sounds like a motor oil, but it's actually an amino acid that is a precursor to serotonin. Or you can take tyrosine, which is also amino acid that's a precursor to dopamine. And improving both of those brain chemicals will help you feel more satisfied. And this is kind of along the lines of what these new medications are doing, is they're working on the brain to help people feel more satisfied. But you can do that naturally too, and it can be very, very effective for some people. So that's another supplement that can work.
I realize there's a balance here, but we've seen the abuses of a low-carb, high-protein diet.
Yes.
Your comments on that?
Well, the low-carb, very low-carb, high-protein diet can be a disaster for some people that have that brain chemical problem where, let's say you have a family history of obesity, you have a family history of sugaraholics, maybe you have sugar addicts in your home, or alcoholism. If you have any one of those in your family or all of them in your family, you're going to be more prone to wanting too much sugar and too much flour in your diet, the inflammatory foods that cause you to gain weight rapidly. So if you have that in your family, you're probably going to need to fix some of those brain chemicals and not go on a low-carb diet. Because if you go on a very low-carb diet, now eating a lot of fruits and vegetables are carbohydrates, so that would not be considered a low-carb diet. But something like the Atkins can be very difficult for some people because they need that brain chemical surge from good carbohydrates. But I would try to steer people away from flour, even 100% whole grain flour, because it still turns into sugar, 100% sugar in 20 minutes once it hits your mouth. So you still have to be careful. And if you have a tendency to want sugar and flour more, then you have to watch those foods because they're so habitual. So, but getting them from fruits, vegetables, small amounts of brown rice, getting more starch in your diet like legumes or beans, sweet potatoes, those are the good kind of carbs that release sugar very slowly into your system. So you're not getting that spike of blood sugar or the spike of insulin that leads to more and more cravings and more fat gain around the belly.
All right. Well, let me go to Anna first, then we'll come back. I have a question about, are we eating right? In other words, are we eating the right things at the wrong time?
Yes.
Hi, Anna, you're on with Nisha. Go ahead.
Thank you. Good morning. I just want to do a quick plug. Nisha, you brought up 5-HTP and the teenage hormone takeover book that you wrote. You know, my daughter was going through the spikes and lows and highs and got her on her amino acids, and now she feels better to take better care of herself. So I want to do that plug. At a minimum, parents need to have that book for their teenagers.
Thank you.
It was very helpful.
Thank you.
And my question for you this morning is, I think I'm doing all the right things, but I have my mouth is stuck together dry at the end of the night. I have dry mouth, wake up, and I have to wake up 3 times through the night, and it's ridiculous how dry my mouth is. And I'm drinking throughout the day as well.
Okay, so if you have a severe dry mouth syndrome, and this is something new, Anna, I would definitely recommend that you be evaluated by somebody for certain types of connective tissue disorders. Okay. There are some autoimmune disorders that can affect the saliva or the mucus and mucus-producing membranes, and the mouth, of course, being one of them. So I think that that's probably a good idea to have you maybe check with your primary care provider on that, because the autoimmune disorders can cause excessive dry mouth, especially if it's something new that has been creeping up. It also just might be that you are not drinking enough fluid. It also could be that you're not absorbing the fluid as well in the gut, so adding more
Flora?
I'm spacing on the name. Adding more of the good gut enzymes, probiotics is what I was trying to say, to your system can help you absorb the water better via the gut. So, but if this is new and it's pretty severe, I would recommend that you be tested for that, because that sounds unusual.
Okay.
Okay.
I will. Thank you.
You're welcome.
All right, good stuff. All right, are we eating the right things at the wrong times? It seems like to me we're eating heavy meals at night and then going to bed, which has got to be a killer.
Yes, I keep saying we need to go back to what our great-grandmother was doing. I used to say grandmother, but now that I'm getting older, you have to say great-grandmother. So, you know, they did everything right. They had a healthy breakfast. You know, maybe it wasn't perfect because it was bacon and eggs and things like that, but at least they were getting, and eggs are back in vogue, by the way, so definitely need to be eating. They're good.
Okay.
They have good things in them, and you need to be eating them. And they're a very low-cost protein. And people are getting chickens, by the way.
Yeah, they're all over the place.
I love my
There's plenty of eggs for sale off the farm out there. Yeah.
Anyway, good breakfast, heavy lunch, very light dinner, almost a snack for dinner, which is the exact opposite of what we do now. A lot of people get up late, they're rushing around the house, they skip the breakfast, they have a little piece of something for lunch, and then they come home, they eat a dinner while they're fixing a dinner, and then they eat the dinner they fixed, and then they have a little sugar afterwards.
Yep.
So that's what America's doing, which is so toxic. That's not when you're burning the fat at all, is in the nighttime. That's when your insulin really gets away from you, and then you're adding more and more food to really make that insulin level toxic. And insulin, just to remind you, insulin is the hormone that's released from fat cells and from your pancreas that causes you to gain more weight around your belly and causes you to have more pain and depression. So you really have to be careful about what you're taking in the evening.
Breakfasts are, they're just not happening. I mean, I get up at 4. I don't, it's almost 9 o'clock. I probably won't eat for another couple hours.
Right.
What have I done to myself?
Well, you used to be drinking a protein shake in the morning.
Which one? There's a million of them on the market. What do you buy?
So find one that does not have any preservatives or additives or Splenda in it. You know, sweetened with stevia or not sweetened at all, and get something that you like, that tastes good. Some people put a little bit of Greek yogurt in it. Some people add some good fruit to it, not too much fruit, but some fruit in it, even just a half of a banana. So that's something you should have within an hour of getting out of bed. The goal is to eat within an hour, because breakfast stands for break the fast. Right?
Yeah.
So eating within an hour of getting out of bed is the key to getting that metabolism going. If you don't eat, what happens is you're continuing to store too much body fat because the insulin keeps going up without eating.
Wow. All right, your website.
VentanaWellness.com. VENTANA Wellness.com.
All right, check it out, and there are a lot of resources there. And get a hold of Nisha and her staff if you need any of these testings or help. Thanks, and we'll get you back. And I don't know what you're going to be. Oh, you'll be closer to that drug, really.
Yes.
The name of it again is?
Belviq, and it could be September, October. We'll talk about it again once it gets closer.
All right, good. All right, we'll take a quick break. We'll be right back.